Hi, my name is Rachel. I'm going to be your nurse today. I'm going to wash my hands before we get started. All right, can I have a name and date of birth? All right, thank you, Mrs. Bear. And do you have any allergies to iodine or latex? All right, you don't? Okay, so I hear you're having some urinary retention. So what I'm going to do for you today is I'm going to insert a urinary catheter into your bladder, and it's going to be able to relieve some of that urine retention that you have going on, okay? You have any questions about any of that? No? And do I have your consent to move forward with doing that procedure? Okay, perfect. Thank you. I'm gonna go ahead and wash my hands and put some clean gloves on. I'll be right back. All right, now I'm gonna go ahead and move you into the dorsal recumbent position, okay? All right, and I'm inspecting the perineal area, and it looks nice and clean. Doesn't look like it needs to be clean, but if it did, I would do that now. Now I'm going to go ahead and remove my gloves and wash my hands once again. And then I'm gonna grab my kit. And two things I'd like to note, in a hospital, this is when I would move my bed up to waist level. Clearly it's not waist level, but we're gonna pretend it is. And also, I'm inspecting my supplies and I'm gonna pretend it's intact because I've been practicing with this one, so obviously it's not intact, but in a real setting it would be, so, okay. I'm gonna go ahead and remove my kit. Alrighty, now I'm going to open it outward, utilizing my 1-inch margins. Okay, and I'm gonna go ahead and grab my sterile gloves, bring them over here, get them on. Okay, alrighty, and now I'm gonna be grabbing out my fenestrated drape. Looking for the shiny side to make sure I can put that side down. Now I'm going to take this and place that down. Get organized here. Okay, I'm gonna squeeze out my iodine, squeeze out my lubricant. And I'm gonna get my catheter situated so I can have everything prepared. Okay, now I'm going to attach my syringe. Okay, and I'm just gonna pre-lubricate my catheter as well here. Get that prepared. Okay, now I'm going to go ahead and expose the meatus and clean it outside, in there, and down the middle. grab my catheter about 2 inches from the tip, and I'm gonna go and feed it. All right, and I do notice urine coming into it now, so I'm just gonna go another inch to ensure it is in the bladder properly. Okay, and now I'm going to pinch with my left hand. I'm gonna take the syringe and I'm going to inflate the balloon. And I am looking to notice if my patient's in any sharp pains or any sign that it is not in the bladder. I don't notice any sharp pains or anything like that. All right, now the balloon is inflated. I'm gonna take the syringe off, drop it, and I'm going to give it a slight tug for the resistance. And now that I felt that resistance, I know it is in the bladder. So I'm gonna remove my hand, and I'm going to remove these gloves, wash my hands, put on clean gloves. All right, and I got my clean gloves on now. I am going to go ahead and secure the catheter to the anterior middle portion of the patient's upper leg. I'm going to take the bag and I'm going to go ahead and secure it to a stable part of the patient's bed. Oh, wow, and I do notice 400 milliliters of amber colored urine. It is clear. I'm going to make sure to document all those things. Wow, you had to go, didn't you? Yeah. All right. So now I'm also going to want to make sure you know that there will be a nurse in here, whether it be me or somebody else, every 8 hours to be completing perineal care on you, okay? Alrighty, and I'm also gonna go ahead and document the date, the time, the type of catheter used, which is a 14F Foley, and that I put 10 milliliters of water into the balloon of the catheter. And how was that procedure for you? Any pain? Oh, just a little uncomfort? Okay. Well, I'm gonna make sure I'm gonna document that, as well as the other things and the color and the amount of urine. And do you have any other questions for me? You do have your call right next to you. I'm gonna go ahead and remove my new gloves, wash my hands once again, and exit the room.